Welcome to the Northwest Nets webinar. People are just entering. Just conscious of the time. I think we should make a start, Rhonda. Do you agree? Yeah.
Yes, Andrea, that would be fantastic.
Okay. So hello everybody and welcome to the Northwest Regional webinar, where we're going to share with you a high-level overview of the Nets results from the Northwest. We've got an absolute sterling panel to provide some feedback, and they'll introduce themselves as throughout the session. We are quite packed for time. We've only got an hour. Just to let everybody know, we are recording this session, so it's available for people who've not been able to attend the session. And I'm going to hand over. So sorry, I should have said who I am. Hello everyone, my name is Andrea Boland. I'm Regional Head of Nursing and Midwifery and Deputy Regional Director for the Northwest for the WTE function, and welcome to this webinar. I'm going to hand you over now to Rhonda, who's going to take you through an introduction. Thanks, Rhonda.
Thanks, Andrea, and welcome everybody today. Good afternoon. It's with great pleasure that I'm welcoming you all to the Nets Show and Tell results webinar today. I do hope that you all find the event useful, interesting, and that you enjoy the presentations. So there's going to be 4 presentations today, and that's going to provide some key findings covering nursing, midwifery, allied health professions, and advancing practice. The presentations will probably last around 10 minutes each, and there will be opportunity for you to ask any questions within the chat. The presenters will endeavour to answer all of the questions within the chat today. However, if they don't manage to get through them all, given time constraints, they will obviously contact you separately outside of the webinar. So just to let you guys know. The most recent Net survey ran last year, so it ran from the 18th of October to the 30th of November, if I remember rightly. And just a bit of background information very quickly. The surveys used really to provide us with insight into multi-professional learning environments, exploring experiences of those who respond across several domains, which really link into our quality framework. The survey is open to all postgraduate and undergraduate students and trainees who are undertaking a placement, practice or training post in healthcare, and it really just seeks to gain their feedback on what has worked well for them and what they feel can be improved. So I really hope that you enjoy all of the presentations today. I'll now hand you over to the first presenter, Michael, who will be providing some insight into the nursing results for the survey. Thank you, Michael. Over to you.
Yeah, thank you, Rhonda, and good afternoon to everyone on the call today. It's great to see so many of you from across the Northwest joining us. So those of you that don't know me, my name's Mike McNamee, and I'm a workforce lead for nursing in the regional nursing team for the WTE Directorate. So next slide. Fantastic, great. So it's great that we're starting with nursing. I'm incredibly passionate. I'm a children's nurse by background, and there's a number of nurses on the call. And with regards to the survey, when we think about professional groups within the Northwest, within the wider health and social care, and from a student perspective, obviously student nurses and student trainee nursing associates make up quite a large component of that workforce. So really pleased to be presenting some of the key findings from last year's survey in regards to the nursing learner profession. So it won't come as a surprise, we've done incredibly well. So starting off on a high, we had over 1,287, get me figures right there, in the Northwest of nurses completing the survey. So as you can see from the middle graph there on the slide, that's our highest sort of contribution completion rate from our learners to the survey for the last sort of 4 years. So pre-pandemic, when we think about that in kind of activity terms. So fantastic, and it's amazing. And I just wanted to give a shout out to all the people who promote the survey, to our stakeholders who are on the call. So all those educators, all those practice education facilitators, all our colleagues in the universities, but more so to our nursing students, because they are the ones that obviously have contributed, and that's what we want. You know, we value this survey in listening to our learners out there in placement in different health and social care settings, and it's really important that we continue to listen to them about their experiences. So a big thank you to all the learners who completed, but equally to all the stakeholders who promoted the survey, along with our comms team. He is now NHS England, and also to our quality team. So a massive thank you, and really that sets the precedent for next year. I'm sure Andrea will agree. We can only increase, can't we, Andrea? So we can only do better. So next slide. Okay, so in relation to in today's presentation, the actual survey results, which Rhonda will show the link later, there's lots of slides and lots of data. So I've basically focused on 4 key areas thinking about nursing in relation to feedback and completion of the survey. And the first one is overall educational satisfaction of the placement or learning environment. And for us, really, data wise, when we look at the number of learners who completed this, you know, it's a positive percentage. We can still do better, so we're working in the right direction. But when we think about it, you know, nearly 79% of the nurses that contributed to the survey actually found that the learning environment was satisfactory, good, or outstanding. So, you know, that's a fantastic kind of recognition and highlight of the experiences that they're having, which, you know, admittedly has been very challenging in our health sphere for the last 2 to 3 years with COVID, cost of living, and challenges around sort of, you know, patient care out there. So massive recognition for that, but we can do better. And actually, as an organisation, in 2002, we committed to launching the HEE, was obviously now NHS England Student Hub. So from a resource perspective, with previous kind of listening events and previous surveys, we recognised that there was a need for a resource there for learners out in practice or in learning environments, and for educators. So the formation of a national student council and also regional student councils were set up, and we're really proud. We were one of the first in England, and we have a fantastic student council in the Northwest, which is led by my colleagues. I think at the moment we've got over maybe upwards to about 70 student nurses and trainee nursing associates now starting to join. So that's absolutely a fantastic you know, initiative. And actually that's where we start, you know, with that engagement and that collaboration and co-production with those learners. So moving forward, obviously we will look at the results in more depth and bring some of those kind of key topics and themes to the student council to really understand really sort of that granular detail of their experiences and what we can do more, what we can do better. Okay, so if we move on to the next slide. So the second theme that I sort of decided to choose for today was that overall supervision, and we know supervision and assessment is key. So within our nursing profession, obviously with the emergence of the new standards in 2019, 2018, you know, there's a big focus on supporting our nursing learners out in practice with experienced assessors, supervisors. But more than that, we know as a student once, many moons ago, that, you know, it's really important to have that positive pastoral relationship between learners, and ensuring that we provide, you know, excellent supervision, which enables the student to feel supported and safe in those learning environments. And, you know, it's not rocket science. We know there's a relationship between retention and students feeling valued in clinical settings, in learning environments. You know, it's directly linked to the quality of the educational supervision that's provided. So there's a key link between those two areas. And, you know, when we look there's 80-odd%, you know, nearly 81% of nurses again rated their overall supervision experience satisfactory, good, and outstanding. Slightly, you know, sadly there was a slight decrease from the previous year, only slightly, but you know, we need to keep our eye on that, because that, you know, even though the percentage is slightly lower, that's telling us something. So, you know, we will be looking at that in more detail around the different themes. And the charts to the right of that slide will indicate the individual questions under that core theme. So each core theme throughout the survey has individual questions which try to drill down to the individual responses in relation to the overall theme. I think the key thing for us is it's around recognising that we are ensuring that our educators are adequately supported to deliver that, you know, supervision, and there's a lot of work around assessor supervisor support in the region, and particular regions have been providing that additional supervisory education or nursing educator courses through CPD, through enhanced training. So we will be again looking at that and seeing how we can support and share some of where it is going well, and we can share it with other parts of the region or other employers and stakeholders. Next slide. So the second theme was around the quality of the placement, which is really key, isn't it? You know, that's where, you know, potentially that's where that individual learns, that's where they build up that confidence, and they work towards their proficiencies and achieving of those. But not that, you know, these are future nurses for our profession. We want them to feel safe again, and also actually draw on the quality learning of their environments, you know, understand and take on board some of that role modelling, because they will in future, you know, not so long, once they enter the register and go into the workforce, they will be the educators, assessors, supervisors of future learners. So it's really key we understand that relationship between role modelling and you know, presenting, you know, that professional kind of component. So around quality of placement, obviously there'll be key themes here that you'll know already. So it's around you providing a formal induction, the opportunity to learn from others in different clinical settings, whether that be through a hub and spoke model, whether that be through an MDT, or where might be in relation to where they are based. If they're in a community centre, there'll be a number of different professionals, a number of different services that they will work with or will have the opportunity to learn from. And also that they're allowed to there's some direction around what they want to learn in that environment. So some self-guided study, but also that they may actually see something that they may want to, you know, go back to in 3 years' time and apply for, or that might be the spark where they think, you know, they've been involved in delivering healthcare with a professional, and they might want to think, right, you know, district nursing is for me, or children's community team. They may, you know, have that fantastic experience, which then sets that seed where they want to go into that sort of career pathway. Again, 80% were satisfactory, good and outstanding, which is great. I suppose in relation to the lowest proportion of the positive responses to this theme, it is slightly lower, but it was an increase on previous NET surveys. So again, somewhere where we can do better and maybe drill down to the granular detail and just see what was working well, what's come back as a positive. So yeah, next slide. So lastly, raising concerns, and I think this is really key. It's in the media. It's a very prevalent theme within our wider health and social care system at the moment. So I just wanted to pick up on this because I know that there's been a lot of work both within organisations and in NHS England, and it's something which we promote really clearly, both as a profession, the regulator, the NMC, but also, you know, as individuals. It's about ensuring that our learners feel safe, but also that they can raise concerns appropriately. So I'm really pleased to note that there's, you know, nearly 96% of our Northwest nurses in training are aware of how to raise those concerns. So I think that's really key. And I want to say thank you to all the Freedom to Speak Up champions, both to our organisations, both to HE previously in NHS England and the HEIs. But I think there's something here about how we are able to empower our learners to raise concerns, because that's a really key thing. You know, they will be on a professional register, you know, in a short while. They will be responsible for ensuring safety for patients, carers, children and young people, and they need to feel empowered and actually able to raise concerns when it's appropriate to follow the right sort of kind of process. Looking at the second section, we've still got work to do. You know, it's not just a case of knowing when to raise a concern, it's actually knowing, do they feel comfortable? Do they feel supported? Do they feel empowered? So there is definitely some more work that we need to do there. And I suppose in relation to sort of previous surveys, you know, it has shown a slight increase, so definitely something we need to do, and we are doing that. So we're raising the profile of the Freedom to Speak Up champions, both at inductions, both at training with our stakeholders and HEIs. They're actually incorporating that process into modular design and curriculum, so that the learners know before they go out into maybe a clinical setting. But equally, I think for ourselves at NHSE, you know, we're really keen to continue to promote that, and to raise sort of the opportunities for those individuals to raise concerns. So next slide. So this slide is something you can look at in detail, I think, probably later on. I think the key thing here is it's always important for us to look back and to try and triangulate themes with the data we're collecting. So it's not just a case of going through the motions each year with NETs and having events like this. It's about really thinking about triangulating the data and possible themes where we see themes that are doing well, but also ones that are not doing well year on year. And this is really reflective for us, and we need to stop as health and social care professionals and consider these emerging themes, because it does take time. It's not just a case of promoting an initiative and then, you know, it's worked really well this year, but actually next year maybe we've took our foot off the pedal and maybe we're not focusing, it's not sustainable, and then we see a drop. So it's really key. And the key thing I think with this slide is the majority of the sections within each theme are showing a general trend of either increasing or remaining the same. So I think that's a positive to take away, but again, not to stop thinking what we could do better. Next slide. Okay, so from a Northwest perspective, what are we doing? What is NHS England? What's the nursing and the midwifery team doing to respond to NET? So I think the key thing is we know how many students completed. It was an increase, which is incredibly positive. Now we've got that here. Now we've got that trend. It's really thinking about what we saw as key themes, and one of those, as I've mentioned, is the freedom to speak up. So we need to do more work, I think, really around that, more promotion, but in collaboration with our stakeholders, with our education teams, with our HEIs, with our primary care and social care colleagues, who are providing fantastic learning environments. I think probably another thing on there is the 46% of student nurses in the Northwest considered leaving. You know, we can't ignore that. And I know that we're all committed on this call. The fact that we're here today and we're listening to these results and we're engaging, we are committed to supporting those future healthcare professionals, and we do not want to lose them. So I think the key thing is, what are we doing with regards to retention and attrition? And we are doing a lot regionally, nationally, but I suppose it's just considering how that then interlinks with some of the survey points in relation to what we did well within the theme of speaking up. So it's some work to do, and it is an increase. So again, something we can't take our eye off. We have listened, you know, we've worked closely with our NETS colleagues to improve in the survey and contributing to that, to improve the quality of education and training for our overall student experience. We will continue to work with the Student Council and draw down on their experience and their knowledge. We'll also look really at how, how we can maybe improve or work towards areas of best practice in the region, because we know there are fantastic areas of best practice when it comes to student learning. And we'll also continue to work with our HEI colleagues and practice partners, which I think is really key. We can't do this alone. Last slide. Brilliant. I'll draw a big breath. So I think we've talked about these. I mean, the key thing is analysing the results and really taking our time to consider what we need to do next. And I've talked about the triangulation, looking back over the last 4 years. I think there's something around specific individual fields of practice that have completed from a nursing perspective. So some learners may be experiencing an improved or outstanding experience, maybe in a CYP or an adult or a mental health learning environment. So I think there's points there to look at how we can improve, but look at what's going well, engage with that learning environment, those partners, that organisation where it has gone well, and get that feedback. Freedom to speak up, I've already talked about this, and raising concerns. You know, there's some really well established raising concern processes for clinical placements. You know, we've got a clinical audit, which is Northwest Clinical Audit, which has been reviewed recently, and you know that's really key with identifiers around sort of raising concerns, how to do that and what process. And I think lastly, really to grow, and we can grow. I think what this year's results have shown us is that we can improve, and we can improve, you know, still within that pandemic. So if we can do that, then you know we can do that going forward post pandemic. And I think it's about engaging with the Student Council overall, and also with our Northwest Quality Ambassadors work, which also includes the student voice, but on a wider multi-professional scale. Thank you. Whistle stop tour. So thank you very much. And as I said earlier, Rhonda will provide us a link to the wider survey for anyone who hasn't had an opportunity to look at that or look at the nursing learning results in more detail. And thanks very much. Enjoy the rest of the webinar.
Thank you, Michael, for providing some really good insights into the nursing results and the key themes that came out. It was very informative, and we're now going to hand over to Gabby, who's going to take us through the midwifery findings. Thanks, Gabby, over to you.
Thank you. Hi, everybody. So my name's Gabby. I'm the Regional Midwifery Workforce Lead in the Northwest for the Workforce Training and Education Directorate. Next slide, please. So we had a significant increase in our response rate this year, and this is potentially partly down to the fact that we conducted focus groups at around the same time NETS was live, which was a really good way to promote NETS to our midwifery students. We had a total of 238 learners complete the survey, and we're really looking forward to hopefully increasing this again next year. So I think it was about 18.3% of our proportion of our students in the Northwest. Next slide, please. Okay, so on this slide, you can see that there's a really positive picture painted for section 1, which is placement quality. 82.8% of our Northwest students reported that their overall educational experience was satisfactory, good or outstanding. And this is an improvement on our 21 NETS results of 79.9%. I've picked one particular question out because it's I can then highlight what we're doing in response to this. So some of our learners reported that their availability of learning and IT resources wasn't as positive in 2022 as it was in 2019. As you can see on the chart, the dark green, the light green and the yellow are outstanding, good or satisfactory. So in 2019, on the far left, you can see there was a higher proportion of students reporting this than there was in 2021 and 2022. We noticed this was a common theme within our focus groups that we did as well, and we decided as a region that we could support a regional midwifery learner IT pilot, and this is allowing us to provide some funding for 3 of our trusts to provide equipment in the form of iPads to 3 trusts that can encourage our students to access these resources, to have private conversations with their supervisors and assessors, to collect the feedback and to do e-learning. And we really look forward to evaluating this later on this year. Next, please. So on this slide, we're looking at section 2, which is placement recommendation. And we found that unfortunately since 2019, we have seen a decline in the proportion of students that would recommend their placement for care or training. However, as you can see on the bottom bar charts, that there is a slight increase in training recommendations from 21 to 22. And we're really hopeful that we'll begin to see an upwards trend now. The reasons that learners choose not to recommend their placements, as you can see on the seesaw, is rota, staffing, culture and well-being were the most frequently cited reasons. We're really hoping that the introduction of a safe learning environment charter later this year, following on from the focus groups, will help improve this. On a really positive note, you can see that the students that did recommend their placement cited supportive colleagues and supportive environments as 2 of the main reasons that they would recommend them. And that's really nice to hear. And it's those positive experiences that we're building on when we went out to do our focus groups to hear what good looks like, and they will help develop our safe learning environment charter. Next slide, please. Section 3, this for me is a really important slide because this ties really closely into patient safety, and it's the ability for our students to raise concerns. So we found that 92.4% of our students feel are aware of how to raise concerns, which is really positive. 61.3 of those feel comfortable doing so. So that, again, like Mike said in his previous slides, that it's really important we highlight the importance and the understanding of the freedom to speak up guardians. And again, we did this throughout our focus groups when we were with the students, and we're really pleased to see that 43.7% do know how to contact their guardian, but we would really like to see an increase in this. Unfortunately, we noted that 26.9% of student midwives have experienced bullying or harassment, which is a slight increase from 2021. Only 24% felt able to or did report this harassment and bullying, and we really want to see the charter that we're developing and some individual support plans that we've implemented really improve these figures going forward. It is something that we really want to work on. Next slide, please. Section 4, this includes some new questions that were new for 2022, and it's a difficult read that 62.6% of our North West students midwives have considered leaving the training programme. I noticed somebody popped in the chat, can we break this down as to why? So for those that were thinking of leaving, we can see that the most common reasons were stress, doubting ability and feeling overwhelmed. But then we ask what keeps them from leaving the training programme, and as you can see on the other side we have the career, the fact that they work with patients, the passion for healthcare and the support that they get from the family. And it's really nice to see those 4 key themes that are supporting our learners to stay, and then we can look at how we can work on these 4 themes. I've popped some pie charts on the other side, which might be a little bit small, but essentially the top one is how staffing levels or have staffing levels negatively impacted your experience of clinical supervision. And this, as you can see, the green section, this is yes. And we're hoping that with recent workforce reports and recommendations, we will see an improvement in staffing levels and hopefully an improvement in student experiences. The bottom pie chart I'd like to bring your attention to as well, that 43% of our learners feel confident they will be supported when they transition from a learner to a newly qualified midwife. We've had a recent publication of the National Preceptorship Framework for Midwifery, and again we really hope that this helps ease those worries and we can support our organisations to enhance their preceptorship offers and increase the positive response rate to these questions. So I want to move on to the next slide, which is an answer to kind of what are we doing in the North West. So here, as the Workforce Training and Education Directorate, we want to support our students to remain on programme, and we want them to be involved, and we want to support them in as many projects and to improve their experiences, really to reduce attrition. So I've highlighted some of the key things that we're doing in the North West. And that includes the already mentioned Safe Learning Environment Charter. This is part of a 3-phase piece of work by the Midwifery Workforce Education and Training team. And this is a national piece of work. Phase 1 looked at the focus groups and will create the Safe Learning Environment Charter. We want to look at phase 2, which is supporting our practice supervisors and practice assessors and the framework in educating them into these roles. And phase 3 will look at coaching, and hopefully when we look at coaching and the benefits and we roll this out effectively, we can improve confidence, which was mentioned on the previous slide. And we also want to work really closely with our simulation teams to improve confidence through simulation learning as well. We've supported staff and learners with an understanding and the embedding of the SSSA standards, which came up in the focus groups, and hopefully that will improve supervision for our midwifery learners in practice. And as Mike mentioned, we have the North West Student Council, and this gives our learners a voice, and we will utilise this as much as possible. And we also have the Student Hub that Mike mentioned in his previous slides as well. So there's a lot going on in the North West in terms of improving our student experience, and hopefully we will continue to see upward trends in the following years now with all the work that we're doing. And that is everything from me and midwifery. Thank you very much.
Thank you, Gabby, for presenting those findings for midwifery and just sharing the next steps and reviewing the themes. There's generated actually quite a lot of thoughts and comments within the chat box, which has been really useful to see. So if people want to have a little review of that, that's brilliant. And I'm now going to hand over to Gareth, who's going to be presenting the findings for the allied health professions. Thank you.
Lovely, thank you, Rhonda. If we can just move on the slides. Afternoon, everybody. My name's Gareth. I'm the Regional Workforce Lead for Allied Health Professions in the North West. So I think we'll just start with a couple of caveats that I think are really important when we're thinking about how we interpret some of these findings. I'm also, they've got very similar themes as to what Mike and Gabby have already presented on, so I'll try and just touch mainly on the differences. what we need to appreciate around allied health professions here is we're talking about 15 different professional groups, and they all have very different placement models. Some where learners predominantly spend the same most of their time of their pre-registration training placements within the same organisation, and other professions where they move around quite significantly and maybe have small blocks or really long blocks. So that's always a challenge that we have with being able to interpret some of this data. We have seen an improvement in terms of participation this year, so that's up from last year, which again is really positive. But overall, our response rate, if we're taking that as again in its absolute form of a sample size, we're still really only accessing 66% response rate across the breadth of allied health professions. So we need a lot more effort to be able to try and really increase participation. And that's vital in then allowing us to be able to have that sub-analysis across different professional groups and to highlight where some differences or unwarranted variation is occurring so that we can then act to improve that. So that's quite crucial as we move forwards. Next slide, please. We have lots of similar themes, as Mike and Gabby have mentioned, around lots of positives here. So let's still celebrate those. We have lots of positive experiences, lots of positive ratings around supervision and quality, around access to induction and learning opportunities and being able to learn from others, as well as feeling like that their learners are in an environment of safe care and observing good multidisciplinary team working. Where we've highlighted some areas maybe where some improvement activities are needed. So it was quite a low number of respondents who were saying that they felt that they had sufficient access to maybe a forum or a group alongside other learners to be able to access peer learning and peer support. So maybe that's an improvement activity that we could choose to act on. And also quite a low number of respondents rated that they had sufficient opportunity to get involved in improving patient care. So I think, again, maybe some opportunities to think how we can enable pre-registrants to get involved in quality improvement whilst they're on placement in our organisations. One of the key things that would highlight, though, is that workload, lots of the learners rated workload as being too high, that then diminish their opportunities for learning. And just trying to get that balance between workload and that ring-fence time to be able to learn, practice, have access to skills development and appropriate supervision time is, again, maybe an area where we need to be able to put our attention to. Next slide, please. So I wanted to pick up on some of the positives here about why people do recommend their placements, just because it really highlights to us the importance of supervision. So time to supervise effectively, as well as the capability of our practice educators and making sure that we have a really positive learning environment. So it comes down to really simple things done well that still really matter most. And it'll be an important part of our work as we move forwards with the publication of an AHP educator capability framework, as well as our broader HEE, now NHS England, wider educator strategy. So we need to be thinking about how we invest in our educators so they have sufficient time for supervision and they feel that they have the capabilities to be able to lead practice education well, as we know that those things matter. Next slide, please. Conversely, for those lower numbers that do then rate, they wouldn't recommend their placement as an area to work. Again, a lot of that then does come down to insufficient supervision or lack of learning opportunities or the quality of teaching and supervisory support that they have. So again, just emphasises that the basics really matter here. Although another key point that we'll pick up on here is around students' sense of their well-being. And again, I want to come on to that onto the next slide as being a key area of focus. If we can move on one more, please. So when we're thinking, for those who are thinking about leaving, so about a third of learners, again, considered leaving during their training programme, stress being cited as the most prominent reason. So similar to what Mike and Gabby have highlighted here, is I think we all need to recognise our collective responsibility across practice and universities here for really thinking how we look after the health and well-being of our future workforce, as well as then acknowledge actually some of those wider aspects of pastoral support, as there are a lot of financial concerns from learners, again, contributing to their stress levels and why they might consider leaving their training programme. Again, similar to what Mike and Gary have highlighted, very positive that a high number of learners, over 90%, feel know how to raise concerns. Actually, the number of those who know how to access their Freedom to Speak Up guardians is still only around a third. So again, positive that there are other channels that people are aware of, but we need to think how we raise that awareness. And again, only a quarter actually really feel confident raising concerns. So again, there's a confidence issue there, as well as then knowing how. If we can move on. Oh, sorry, I think that's my last slide. So I'm just going to touch on some next steps, as include a next step slide. Because I think there's some things here to be aware of in the background. If anyone wants to be able to access a more full detailed report, we'll be sharing that round after today's webinar. And if you have any questions, do just contact me directly. There is some work that we're going to be gathering together across the country. So our regional allied health professions leaders will be meeting in the next month to really look at AHP findings across England and what we need to be picking up and working on, and maybe what needs some attention around our improvement programmes in this financial year. Also, for colleagues just to be aware of, we have some specific work that's been undertaken by our repair fellows this year around operating department practitioners and occupational therapists and their experiences during their pre-registration training and their preparation for practice. So we have some targeted work there that we need to be able to take forwards and progress with. As well as we've done a very large piece of work with multiple elements to it around paramedic practice education, and there'll be some improvement activities that come out of that work too. And I think that's it for me. So I'll pass back to you, Nick, yourself, Nick.
Thank you very much, Gareth. That's brilliant. Right, let's just get okay. So thanks very much. My name's Nick Worth. I'm part of the Northwest Faculty for Advancing Practice. I'm the supervision and assessment lead, and so part of my remit comes into sort of helping support the quality team from advanced clinical practice within the NET survey. So we'll just go through a few similar types of things as we have done with the other speakers about the numbers and that type of thing of what's happened. So with our responses to the NET survey that was October, November 22, we had 101 people respond that identified as ACPs or trainee ACPs. Obviously, with ACP, it could be multi-professional, so sometimes it depends on how people were responding. But we've got a good number with this, and that's really a lot higher than we've had in previous years. The other thing with that, though, is that whilst those numbers were really positive and have made a really big difference, it is only sort of 8.41% of what we're aware of the population of ACPs within the region. So, you know, we look about where Mike had said about the NET survey from nurses, and it was a similar sort of a percentage. But then you look obviously with the midwives being 18.3%, and it'd be interesting to see whether we can increase this in the future, because the more figures we get, that what we'll be able to do is actually then get more meaningful data and be able to support learners in the future. So just kind of in comparison to where we were over the last few years. So the NET survey from ACP was very small. In 2020, we only had 9 responses. 2021, we had 35. And so we've gone to 101. And just to that breakdown on where we were in terms of as a region compared to the rest of the country. So there was 607 for the whole country in advanced clinical practice, and 101 of them came from the Northwest. So we probably sort of punched above our weight really of what we were doing, but it would really be something that we'd like to look forward to. So the way we did it this year and why we sort of tried to get a big response, you know, we shared it across the HEIs. So we were trying to encourage the university program leads to share it within their learners, but also made a difference to actually have a contact with our ACP trust leads. We had a much bigger sort of social media campaign and really worked to sort of advance things for everyone. So we were putting them out on a regular basis. And then the other thing we did was Helen, Rhonda and the quality team were sending me weekly updates of how the responses were coming in between the regions. And what that meant, actually, we started to create a little bit of competition, which was quite a good way of actually increasing numbers. So what we would often do is I'd send an email around whenever I got the up-to-date figures, and what people would be able to do is mark themselves either between HEIs within the Northwest or sometimes region to region. And so there was a little bit of encouragement to go, right, what can we do and how can we improve things? So that healthy competition helped to drive numbers up. The difficulty we have with nets is the fact that because it's kind of quite a small number, really, it's difficult to really extrapolate that number when we know how many learners we have and ACPs across the region. And so usually when we're talking about the net survey, and there is a link at the end, there'll be a QR code for you to be able to access your figures, whichever area or specialty or profession you're in. Sometimes it's tricky to be able to get all of the detail. So actually, you need more than 3 people responding in one area to give any kind of meaningful data, because if someone says that they're having a good time or a bad time, that will suddenly skew the results. One of the things we have seen in the last couple of years is sometimes when there are quality issues raised, they don't always reflect what's in the net survey. And so realistically, this is why the increased response rate is so vital, and for all of the different professions and all of the different specialty areas, because sometimes, we can hopefully, by understanding where there may be potential problems or where the learners are having struggles, what we can then be able to do is maybe almost head off any quality issues before they actually start. And that's really what we want to try and do, to be able to improve the facilities and support for all types of learners. If we go into just a few of the highlights for ACP, realistically, looking at the figures there, the overall experience was outstanding, good or satisfactory for 81%. That's obviously, it sounds like a great number, but like we've looked before, that might mean that the 18.8 people aren't having such a good time. Those are the kind of things that we want to be able to drill down on, and we're working with trainees to try and understand the figures a little more. So where we said there about the supervision that ACP learners are getting, there was nearly 80% said that it was satisfactory, good or outstanding. Now, again, that's a decrease on last year's results, but the difference is we have to take that in context, is that's out of 35 people last year and it's out of 101. So we are getting sort of better granular data and being able to understand exactly what people mean. But these are the kind of areas that certainly myself as a supervision and assessment lead, but as a faculty, we're working hard to see what we can improve and develop. And so certainly some of the things that are coming up, there's a national supervision framework that will help sort of get some training and better resources. Also launched last year was the minimum standards of supervision document. So we're helping trying to roll that out and improve so that there are minimum standards that if NHSE, we're actually funding and supporting an ACP trainee, that they should actually get the high quality of supervision and support that they deserve. There is some money within the education grant that actually goes to support them. And so really, this is where we want to be able to really push that further and further and further. Just a little bit in terms of the kind of well-being. So, most people at 94%, that number in the middle there, saying that well-being was available, which is a good number. Basically, the understanding that the 87% reported that they had no discrimination, and that 85% felt that they felt supported. These are obviously good figures, but there's still that gap as to understanding what's happening to those ones who maybe either feel that they're not supported, or is there a gap in sort of understanding, how they may escalate concerns, and are they being taken seriously? Just like we've said before in the previous speakers, things like the Freedoms to Speak Up Guardian and being able to have their concerns taken sensibly and listened to is really important for people's well-being. A lot of people in terms of the formal induction, I think one of those things with induction, particularly for ACP trainees, because generally the trainees are moving from a position where they're going to be taking on increased responsibility or clinical complexity. I think it's really important that having an induction and understanding the role, understanding the journey that they're going to go on as clinicians, to be able to take on the maybe sort of other of the 4 pillars, so leadership or management responsibility, education or research responsibility. That induction is really important, to be able to show people what's expected of them, how they can create their job plan, how they feel like they're going to work whilst they're training, and then what happens afterwards in the outcome once they're post-qualification. The charts there, again, they may appear a little bit small, but it's about actually how does the workload support training. So the idea really with that is that it looks on the right hand of the columns. What we've got is 56.4% felt that the actual amount of work that they had and study time was about right. in the red, which on the right hand chart says it's 38.6 felt that they were slightly overworked and working too hard, and 5% felt that they were underworked a little bit and had more time. If you look at those responses from in the 4 columns being 2019, 2020, 21 and then 22, understandably, when you look at the 2020 year, no one in that year felt that they were being underutilized given what we were going through with the pandemic. But then what we're trying to see now is actually probably as the advanced practice faculty are actually helping to be advising and supporting supervisors, employees, trainees, that type of thing. What we're hoping to try and find is actually understanding the workload that's required to be able to be successful in your training and still feel supported and not overworked as things progress. There's lots of work to be done, and that's what we're still going to be working through. And so this is what we're trying to do and demonstrating where the faculty have made inroads to try and support what's happening for the future. If you want to at any point, the QR code on the right hand side of your screen, that will take you to the web page, which is the Northwest Faculty for Advancing Practice. From that web page, if you want to click on that, there's all the details in terms of either signing up to a newsletter to be able to gain information and support from us, contact details of all the training program directors or the faculty.
I think Nick's frozen on us, unfortunately, I'm afraid, but I do think he was coming to the end of his presentation. We'll just give it 30 seconds just to see if he can. Are you back?
Yeah, sorry about that. That suddenly jumped off at the wrong time. So we're having regular ACP leads meetings. So what we're doing is we're talking to the universities and all of those people that set up the training, so that we're able to understand the needs of trainees as they progress. We're working with trust leads, and we have regular meetings with those. What we haven't done yet is share all the NETS results, but what we're going to be able to try and do is enable the AP trust leads to be able to have a look at their results individually within the reporting tool. And there's a link to that coming up in a moment on the next slide, so that you can be able to identify whether there are any areas of concern within your trust and how you might be able to address them. But remembering that as a faculty, we're here to support you with that. We do regular quality monitoring. So with the HEIs, we do that via what was HEE and what's now NHS England accreditation. So that's what we're able to do with that, is assess the standard of the training that's being delivered through an HEI. But then we do an annual quality monitoring if there are any changes, if there's anything that we need to be concerned about. And we work closely with Rhonda, Helen and the rest of the quality team to identify where there may be quality concerns. And then what we use is we use the NETS data to almost like triangulate to see, is this something that could have been foreseen? Is there a way of being able to prevent things? That's really what we're trying to work towards. And then one of the other things we're trying to do is we're trying to share the best practice. I know that someone else had mentioned before regarding one of the other talks. What we want to do, there's so much great work that goes across the Northwest, particularly from our point of view in advanced clinical practice, which is a slightly sort of evolving and developing area. There's so much good work that often things get done and then it gets put away in a cupboard, or it's done for a poster presentation. We need to showcase and champion and shout loud about all the great things that happens. So what we're looking to do is we're building up a resource bank within the website with the Faculty for Advancing Practice. So if you've got a case study, if you've gone some service development, if there's just a great clinician, if there's something happened where something has been really innovative, that's really what we want to hear about. And then what you'll find is if we create maybe a poster, a case study, it can go on the website. Other people could then look at that and maybe think, actually, I can adapt that and bring that into our area. That's what we want to try and do. And then we have training program directors or TPDs within a variety of specialties. We have 7 at the moment, but they're both primary and secondary care. There are a variety of professions. So if you need to get hold of anyone for a little bit of help and support, again, click on the QR code that's on the screen now, and you can have a look at when it says meet the team, you can be able to find out who they are and email them directly, or you can always contact us. That's it from my point of view. I'll hand back to Rhonda just to sum up, and there's the link there just for the reporting tool.
Thanks, Nick. That's amazing. Can I just thank you all for attending today, for your time, your interest, your passion and your ongoing support for this work. Can I also give Tom Connell a big thank you, please, from the Northwest Quality team for producing all the data and analysis for today and helping very much with the slides. And then can I also thank all the presenters for their presentations. I know there's been a lot of information that's been shared, and I just really hope that you've all found it quite informative in identifying good practice, in actually really drilling down maybe in some areas where improvements can be made. And as Nick said, there is a QR code, a link there for the NETS reporting tool for those individuals who may wish to further explore any of the data and results. So you can actually go in at a national, a regional and a provider level. The tool does provide a series of high-level reports. It also has quite an interactive dashboard that you can filter on to analyse and summarise whatever response data that you're particularly interested in. So thank you again for attending the webinar today, and I do wish you all a good rest of your day. Thank you. Take care, everybody.